That looks great.
Awesome. All right, well, good morning, everybody. I'm so glad to see all of the beautiful faces. Let me change this so I can kind of look. Thank you for those of you that are on camera. It really helps me to know who I'm talking to this morning. We're talking about separating myth from fact, how you as a CHW can support consumption of accurate and factual health information. So I always start my presentations with not really housekeeping, but kind of housekeeping, but certainly participation expectations. So first things first, this is a very informal and interactive training. I don't like talking to people. I like talking with people. So your participation is highly encouraged. At any moment, please feel free to raise your hand, ask a question or a comment. I would prefer actually if you raise your virtual hand, or if you put in the chat your question as opposed to actually coming off of mute, because we do have quite a few people on the call. If you have a webcam, again, use it if you can. I'd love to see your smiling face, but you don't have to feel pressured to do that. I know it is still early. It is for me anyway. Ask questions. The more questions, the better. And thank you in advance for your attention and participation. So I wasn't here when the bio was read, but it should have been just a short blurb. I'll go ahead and introduce myself again. I am Quisha Umemba. I am a registered nurse with a public health background. I like to say I am the nurse that got bit by the public health bug. I haven't been clinical in a number of years because I fell in love with public health and just stayed in public health. I am the CEO of Umemba Health LLC, that is a public health and education agency. We like to think of ourselves as the one-stop shop for community-driven approaches. And what we try to do is really work to improve not only public health, but population health practices as well. And we do that a number of ways. One of those ways is by supporting organizational performance, health systems, businesses, nonprofits, et cetera. And also by supporting individual development, doing things like we're doing here today. And one of the ways that we do that is through Umemba Health Academy. Umemba Health Academy is a virtual campus for CHWs, for CHW instructors, and also for other frontline health professionals as well. And so our work through Umemba Health Academy is really to elevate the multidimensional skill set of the frontline workforce through competency-based instruction. Again, very much like what we're doing here today. I am joining you from Dallas, Texas, and currently the state of Texas in a custody battle. I saw this on social media, I'm gonna use it. Summer and winter are fighting for custody of us right now. I woke up this morning, it was about 24 degrees, but that does not mean it will not be 80 degrees on tomorrow. So probably you're experiencing something similar, but here in the South, we go through this all of the time. So now you know a little bit more about me. Go ahead and tell me who you are. I think some of you already shared in the chat, but as I came in late, I don't see that information in my chat. So tell me your name, tell me your city or your county where you're located, and tell me the organization that you are employed with. And thank you in advance for doing that. I always like to know who I'm talking to. And I'm gonna actually open my chat up and put it over here so that I can see. Awesome. Thank you again for introducing yourself. And while you're doing that, I'm going to go ahead and review our learning objectives and our agenda for today. So by the end of this workshop, you should be able to do a few things. I want you to understand why misleading health information is a threat to public health. I want you to be able to demonstrate how to spot fake and misleading health information and prevent its spread. And I want you to be able to support your clients in searching for health information from reliable sources. Now, this is our agenda that coincides with our learning objectives. I will provide a disclaimer. I'm normally pretty good on time. The last couple of presentations, I've been pretty chatty and I've been off a little bit. So I'll try my best to stick to this timeline and this agenda because I really want to open up the floor for any questions that you all may have. So let's get started. The first thing we're going to talk about, oops, sorry about that. For the first part of our discussion is why misleading information is a threat to public health. And thank you all so much for putting your information in the chat. I really, really appreciate that. I'm going to share about 3 or 4 quotes with you throughout the session this morning. And this is the first one. This famous quote comes from our 16th president, Abraham Lincoln. And he said in this quote, "The only problem with quotes found on the internet is that they are often not true." What do you think about this? Do you think that he was right? Do you think this is a factual statement? If you want to do a kind of thumbs up, give me some thumbs up with your emoticons there. Tell me what you think about this. Abraham Lincoln, our 16th president. Think this is factual? You think what he said was correct? I see a smile, Carla. I see that laugh. That's funny. Looks like I see Anissa is chuckling as well. Why are we chuckling? Who thinks that president was right? I mean, it sounds factual. I would say that this is right. Ha ha, okay. The internet wasn't around. Absolutely, he would have known about it. So of course, President Lincoln is not the originator of this saying. This quote is a perfect example of the point that I'm trying to make when it comes to misleading information. It's easy to share information these days without determining the accuracy of information. Yes, this post is harmless. It doesn't hurt anybody. If it's shared, that's okay. Nothing will happen as a result of it. But that's why it's important for you as a CHW to be able to vet information, because sometimes information that is shared can be harmful. And one of the things that I want you to be able to do today is to really be able to vet information and help your clients and patients find reliable health information, especially reliable health information online. So let's dig a little bit deeper into this topic. Unless you've been living under a rock, you know that we're currently living through a pandemic. However, you might not have known that we're actually living through two pandemics. Oop, I got muted. Can you hear me? Can you all hear me? Okay, great. The COVID-19 pandemic and the infodemic. So we're living in a time when false, inaccurate, and misleading health information is far-reaching and rapidly spreading. And as facts, rumors, and fears mix and disperse, it's becoming increasingly more difficult to learn essential information about an issue or a health topic. So I want you to look at this information that comes from a study that analyzed the fake news stories that were circulating on social media about the COVID-19 pandemic. This is actually a study of that was developed by 3 researchers. 2 of them have PhDs in library and information science, and one of them is a postgraduate in the field of pharmacology. So they conducted this content analysis of 1,225 fake news stories that were published in a year from January 2020 through April 2020. Sorry, actually just a few months. Of the 1,225 fake news stories that were analyzed, they found that 50% accounted for being spread through online sources, through social media. The other 50% of those sources came from a variety of multiple sources. They came from individuals like us. They came from our former president, Donald Trump. They came from a variety of websites, and then a combination of newspaper, websites, and tabloids. This study ended up concluding that the COVID-19 infodemic is full of false claims, half-baked conspiracy theories, pseudoscientific therapies, and all kinds of misinformation about the diagnosis, the treatment, the prevention, the origin, and the spread of the virus. And this is just one study of several studies just like this one that call out the main culprits of the infodemic, which are misinformation and disinformation. So let's explore those 2 terms in more detail. Misinformation is false information that is spread regardless of whether there is an intent to mislead. It is usually unintentional. And when we talk about misinformation, we're talking about things like inaccurate captions, incorrect dates, incorrect statistics, mistakes, human error. Disinformation, however, is deliberately done on purpose, spreading and sharing misleading or biased information manipulative narrative or facts or propaganda. It involves fabricated or made up stories, manipulated images and pictures, and intentionally created conspiracy theories or rumors. Now, regardless if the information shared is unintentional or not, the problem with misinformation and disinformation is that it can be dangerous. Broad dissemination and consumption of false or misleading health information, when it is amplified by the internet, poses great risk and harm to public health. So your patients and your clients deserve to know the truth so that they can make the most informed decisions about their healthcare. However, they cannot do this if they get bad information. So let's get to the root of this growing problem. False and misleading health information, we've already established it's been circulating widely in the media for several years. And a problem that our society currently faces is the pervasive availability and consumption of false health information thanks to the internet. Now, I love the internet like everybody else, not particularly in love with social media, but I understand its reasonings, right? Its purpose. And the internet and social media in itself, they're not bad. However, they have enabled misinformation to spread rapidly and effective. Think about search engines like Google that allow anyone to easily find information about just about anything. You've got social media sites like Twitter and Reddit and Facebook that provide forums for private citizens like you and I to freely express our views, including views about medicine and healthcare. Content disseminated through websites and online communities, you know just as well as I know, that content is unregulated. So you can basically say what you want about whatever topic, and there's no one there to really dispel that information. Yes, information campaigns, they can be deliberate, like we talked about, and they can be meant to cause harm, but often in a lot of cases, people just don't know where to go to find the correct data and find the correct facts. So, or sometimes they just don't take the time to do so. But whatever the reason for the misinformation, again, your role as a CHW is to combat the misinformation and the disinformation and to support your clients in identifying reliable health resources. It's really important that you are part of the solution, not a part of the growing problem. So now I'd like to get some feedback from you, and please use the chat to provide this feedback. What are some challenges that you've encountered when working with family, friends, and clients regarding misleading health information? Because I will be honest with you, combating information from Google and from social media and, gossip from friends and family, it's not easy work. And there are lots of challenges when you're working with clients and patients trying to, dispel those myths and lead them to the appropriate resources. So use the chat and tell me some things that you've experienced. I'm sure all of you have some examples that you can share related to COVID-19. But yeah, just give me a few of these and I'll read them off. Thank you, Vanessa. She says, confused leads to no trust for us that want to help and make a difference. Absolutely, it's so confusing. You don't know if this side is accurate or this side is accurate, who's telling the truth, who has a vested interest, who's out there. Believe it or not, there are people that are out there that just want to cause confusion. And so that's a really, really good point. And it does lead to more distrust, especially in communities that already have an issue with trusting healthcare professionals in the first place. Miranda says it's hard when you have some questions yourself. Miranda, thank you so much for that comment. One of the things that I always do when I'm providing education, especially with sensitive topics, is I ask my CHWs, what's your viewpoint on this? How do you feel about this? It's really hard for you as a CHW to tell your patient or client they should get vaccinated against COVID-19 when you don't really believe in COVID-19 vaccination. So that's a really, really good point, Miranda. You can't sell something that you don't believe in. That's like, I think, rule 101 of being a good salesman. You have to believe in the product that you're selling yourself. Let's see, Deborah says you cannot argue with someone with what they believe in. Deborah, you have been doing this for a long time. That is so correct. And a lot of times people will say, well, you know what, I just have a patient that keeps pushing back, and I've told them and I've given them the facts and I've given them the information. Guess what? You did your due diligence. You cannot make people subscribe to the information or the viewpoint that you're sharing with them. Your job is only to provide the most information that you can to them, and then let them come to their own conclusion. So thank you for that comment. Yes, people don't trust COVID. It's difficult at times to know where to go for the actual truth. We're going to talk about that today, Shelley. When the CDC flip-flops constantly. Rebecca, I always have wanted to work for the CDC, and I don't know if my career will take me there, so I'm actually not going to comment on that. But thank you for that comment. It is hard when the leading health authority constantly changes and makes recommendations. You know, wear the mask, don't wear the mask, quarantine for 10 days. No, just quarantine for 5 days. It makes it increasingly harder. These are all really great. I'm not going to be able to read the rest of them, but thank you so much. So these are the challenges that we're working with our clients. And it is an uphill battle at sometimes. It's not easy work. And I acknowledge that and commend you all for doing this work on a daily basis. So now we're going to discuss how to spot misinformation and prevent its spread. And this is the work that you're going to be doing with your clients as well. So again, I can't remember who provided that comment, but you have to learn it first, right? You have to understand the skill and be able to practice it before you can then teach it to your patient. So let's discuss how to spot misinformation and prevent its spread. And I love my quotes. So before we begin, here's a quote from CNN news anchor Brianna Keeler. And she was quoted saying, "Misinformation is a virus into itself. Misinformation is a virus into itself." I absolutely love that quote. So we're going to watch a quick video. It's about 4 minutes long. And this short video is titled 5 Tips to Spot Misinformation and Prevent Its Spread. It's going to review the definition of misinformation, why it's so common, how to identify it, and what to do when you come across it. I want you to be sure to pay attention to the video and the topics being discussed, because I'm going to be checking your knowledge afterwards. So let's play that now, and give me a thumbs up if you can hear my sound. You should be able to.
We're living today in what is considered a post-truth era. That means we're living during times where subjectivity reigns over objectivity. Any information that we receive in this post-truth era, it goes hand in hand with understanding that what we see impacts our beliefs and then impacts our actions.
In this episode, we're tackling misinformation, why it's so common, how to identify it, and what to do when you come across it. I'm Nicole Ellis. This is the new normal.
Misinformation refers to content that's false, but that wasn't necessarily created with the intention of harming a group of people or a country or an organization.
We are constantly looking around for cues that things are true and false in situations where we're unsure, right? And we tend to hear things that are true more times than things that are false. So repeated information feels truer than new information. You can imagine when fake news is being shared repeatedly, that becomes a problem.
There was a study that was done by Common Sense Media in 2019 that actually showed that the majority of students in our nation lack the skills to decipher between factual and uncredible information. That can be fixed through education and skill building.
I feel like the challenge, and really the bigger issue that we're all trying to navigate, is how to build those media literacy skills.
The first tip is to ask yourself, what type of information am I engaging with? Is this information credible? It also helps you understand as a viewer and consumer that all media is created by an individual. So that individual's perspectives, backgrounds, and biases may have the ability to impact the messaging, the content, the imagery of what is presented. The second step is to check your own biases. You have to ask yourself certain questions like, where did I get this concept or this idea or this belief system? Where did it come from? Is it something that I read? Was it something that was taught to me? Is it based off of my religious beliefs? When you understand how your beliefs have framed your approach or the lens in which you see the world, you will then understand how that lens can either be foggy or clear when you engage with media or news. We have to take an open-minded approach when we engage with information, because otherwise we may shut out the opportunity to find truth.
What we don't want is a situation where people are skeptical to the point where they're not accepting credible information.
Research has actually shown that individuals that engage in active, open-minded thinking, they are less likely to experience strong, polarized beliefs online when they are approached with misinformation.
But even if you're going in with an open mind, how do you make sure that what you're looking at is credible?
So there's different ways you can do that, either by fact checking, but then there's also this skill called lateral reading. Lateral reading is when you take different windows in your screen or on your phone and you look at the different sources and the different articles about that topic and what is being said, to look at it from different perspectives and find that kernel of truth.
You know, as journalists, it's our jobs to be looking at multiple sources, but for everyday people, they just may not have the time. So I'm curious to hear, what's the next best option?
Focusing on things like whether the site is credible and follows standard journalistic practices. You'd be surprised, 59% of links on Twitter aren't even clicked on before they're shared. And so those are missed opportunities to notice that a website is really shoddy and shady looking. Often these fake news sites, if you actually went to the site, it would be really obvious that this is not a credible news source.
If you see someone that has actually posted misinformation online, send them a DM and let them know that, hey, that information is actually misinformation, and provide a link. Do not blast anyone online in front of people, but educate others.
Misinformation has so many dire consequences, from the reemergence of diseases that were thought to be eradicated to harming the environment, literal violence, political violence. So to the extent that we can each play our part and be more mindful of what we're liking and sharing, we should do that.
We're gonna keep covering topics like this, so stay tuned. For more stories like this one, find us at thelily.com and washingtonpost.com.
We're living
Okay. Sorry, Brian.
Today in what is considered.
Sorry, Brian, if you couldn't hear that, but I think everybody else could hear the video. So I want to check your knowledge and really bring up some points that were mentioned in the video that I think are important. So first question, just a little game. This is true or false. And I want you to use your chat to either put T or true as I ask you these questions. But according to the video, misinformation is content that is false, but not necessarily created with the intention of harm. True or false? Content that is false, but not necessarily created with the intention of harm. And everybody has got this one correct. That is true. All right, that was an easy one. So let's go to the second question. A study done by Common Sense Media in 2019 showed that majority of students in our nation have adequate skills to decipher between factual and credible information. Is this true or false? False. Absolutely correct. Actually, according to the video, majority of students did not or do not have adequate skills to decipher between factual and credible information. And so if you don't have the skills to actually decipher what could be accurate and factual versus what couldn't, you're continuously a part of the problem and perpetuating the issue. And I think that's what's actually happening with society, and especially with social media. So majority of you have that correct, or all of you. The third question, the video talked about a technique called lateral reading. It allows you to look at different perspectives of a topic to find the kernel of truth. Is that the definition of lateral reading, true or false? And let me rephrase that. Lateral reading is a technique, according to the video, that allows you to look at different perspectives of a topic to find the kernel of truth. Is that true or is that false? That is true. So I will be honest, when I was preparing for this presentation, that was the first time I'd heard of something called lateral reading. I'm sure in journalism, it's something that's very common to them. What it did remind me of is when I conducted literature reviews in grad school and undergrad, right? So one of the things that really should stand out for you as you're looking to decide or decipher if something is a credible resource is if there's multiple articles on that particular topic. If you find a topic and you can not only find that one article, that one source of truth, then chances are there's not very much credibility in that particular in that resource. So I really like the idea of lateral reading. It's something that you can do and something that you can also inform or advise your patients to do as well. The fourth question. According to the video, only 10% of the things on Twitter are not clicked on before they're shared. Basically, you see something on Twitter, it's got a provocative title, you automatically share it without clicking on it to reading it for yourself. And the video, did it say 10%? 10% of things on Twitter are not clicked on before they're shared, true or false? This was a tricky one. Some of you said true, some of you said false. This is false. The actual statistic was 59% of things on Twitter are not clicked on before they're shared. Now, is anybody else going to be honest with me and say that they're guilty of doing this? I know I've done this, but I'm not on Twitter. I couldn't take Twitter, but I'm on, Facebook, and I'm on LinkedIn and Instagram. And I will be honest. Thank you, Don. I will be honest and say I have done this before, especially, and we'll talk about confirmation bias in a little bit, especially if it's something that already agree, if I agree with it, if it's my viewpoint as well, then I tend to share it without actually reading it. So again, this was one of those things where I was putting this presentation together like, oh, I just stepped on my own toes. So that's something we have to be careful of. And then the last question, one of the ways to build media literacy skills is to explore the bias of others. Is this true or false? They talked about this in the video. One way to build media literacy skills is to explore the bias of others. Is that true or false? Explore the bias of others. This is false. One way to build media literacy skills is to explore your bias, okay? Exploring your own bias helps to build health literacy skills because it helps you understand the lens in which you see the world. Shantae says both. Oh, wow. Shantae, would you like to come off of mute and provide us with a little bit further kind of explanation as to why you think, not to say you're wrong, I just love to know your viewpoint. I don't want to put you on the spot though, so if you'd rather put it in the chat, then you're welcome to do that as well. All right, we're going to continue. So we're going to talk about a strategy that's really, and Tia agrees with both as well. Thank you both, ladies. We're going to talk about a strategy that's really helpful in quickly diagnosing the accuracy of health information, especially online health information, and to scan it to see if it's credible, if it's factual, if it's accurate. And so this is an acronym, ABC, where the A stands for authority. Does the information have authority? Is it credible? Is there a means to verify the source so that you know it's legitimate? Have you used it in the past or referred to it in the past? Does the website end in edu? Does it end in .gov or another type of credible source? Can you verify the author? Are there links and references to other reliable sources? Can you trust those links? Things like that. The B in the ABC method stands for bias. Can you spot bias in the article or the post? This means the writer may have had other interest, if there's some bias, besides education and information sharing. Not all articles and posts and information are meant to be real news. Some are fiction, some are satire. So is that article pushing a single point of view? Does it feature a shocking or a provocative headline? Things like that help you identify whether or not there's bias. The C stands for current. Is the information current? Does the website have a date? Is it outdated? When was the last time it was updated? Do the links work, or are they broken on the website? All of those things are what you should look for when you're trying to spot false information. So now we're going to use this ABC method and vet some health information that I found online. I actually Googled most of these images. And so I'm going to show you, I think, 5 examples, and you're going to tell me what information is lacking, whether it's lacking authority, bias, or current and up-to-date information. So this is the first post here. This is actually an article that's circled. This article was found on Facebook, and I'll read it there if you can't see the title. The title says, "Why are vaccines laced with artificial coloring chemicals made with aluminum, a toxic metal that," you can't read the rest of it. And then there's a little blurb that says, "A list of vaccine excipients released by the CDC in January 2017 continue to raise safety concerns as immunization shots." And then there's an ellipses there and we can't read it anymore. So without reading any more than that I've read to you, how would you decide if this was a credible source or not? What about this entire page stands out to you? Again, remember your ABCs: authority, bias, or up-to-date information. Authority, bias, or up-to-date information. What do you all think about that title? That title is very provocative. Yeah, Lauren, definitely some bias. Yeah. Maybe some bias. Yeah. What about this? Do you see, okay, so that's the title there. Do you see that? naturalnews.com? Really? naturalnews.com? I've never heard of it. I don't know if y'all have heard of naturalnews.com. I have not. I don't think it's a credible website. Somebody mentioned the date. I don't even think I circled that, but that's very true. The date 2017, absolutely. So it's dated. I circled articles here because if you notice from looking at kind of the top article and the third article, this is a list of curated articles that are obviously anti-vaccination type of articles. Deborah says, why? Starting off with this word already shows bias. Absolutely. Absolutely. So there's issues with all three: authority, bias, and up-to-date information. Let's do another one. So let's look at this social media post. This actually came from a Facebook page titled "Prayers for Ezekiel." What stands out to you about this page? What do you see here that would kind of question, have you questioned the authority or the bias or whether or not it was up to date? Aha, excellent, Carla. In essence, it's sponsored. And sponsored content or ads means there's somebody has a vested interest, right? There's probably some level of bias in this post. Okay, what else do you see here? Look at that date. Thank you, Patty. This page was created in 2022. Don't know when this was posted. We can't see the date. It's an ad. They usually don't put the dates for ads, but the page was created in 2012. Page hasn't changed at all. So it's pretty, I wouldn't say it's outdated, but we know that the page is dated at least, right? So if you're doing prayers for Ezekiel in 2012, Ezekiel looks to be less than 1. So he's got to be way older than that. Now, what is this? Rebecca says they're spending money to elevate their ask. Absolutely. They're spending money to elevate their ask. So definitely some bias issues and issues with up-to-date information for this particular post. Let's look at this social media post. What stands out to you here? Do you think if you saw this post online, you would think it was a credible resource? What stands out here? I'll give you one. This title is pretty provocative. The cure for cancer. Finally, the cure for cancer will be announced. Yeah, that automatically captures people's attention, especially if you have cancer, right? Automatically capturing your attention. The source, thank you. iJuiceNow.com officially announcing the cure for cancer. iJuice Inc. always ready. Okay, so I've never heard of iJuice Now, but it's a very provocative, kind of eye-catching title to that link. Lauren says the doctor is a naturopathic practitioner, not an MD. So I'm not, I'm not going to knock naturopathic practitioners, but for some people that could not be a credible source. Now, if you go and you research him and he's got all these peer-reviewed journals and he's doing this great work and research studies, then he's a credible source. But if you, Google him or look him up and you can't find anything else about this Dr. Robert Young, then that's certainly a cause for red flag. So absolutely all of these. Deborah says officially. Yes, officially. Who said it's official? Not to say that, CDC, like we see, they like to change things, right? But, if it's not .gov or .edu or some official website, then can they really claim that they officially have the cure for cancer? So we certainly have some issues with authority here. And I say some bias issues as well, because I'm sure Dr. Robert Young is probably going to get a pretty penny for sharing and marketing this information. Okay, let's look at another one. So this again is a social media post. What stands out the most to you here? Would you think this is a credible resource? Why or why not? Now there's a lot going on in this post, a lot going on in this post. So you all tell me the source. Yeah, source for sure. There we go. StopMandatoryVaccination.com. Mom asks why her 6-month-old infant died after getting 6 vaccines. Yeah. Oh, Rebecca, clickbaiting. This is where we talk about clickbaiting on this slide. The imaging, the title there. Katie Clove shares her tragic story with us. This is pulling on heartstrings. This is sensational. This is emotional, right? It opens up with the word tragic. I can't even get it out. So really trying to play on sympathy and emotions. It tells you to share essence. Absolutely. That's how you know it's clickbait. Not only does it tell you to share, it says, do not censor this story. Click to the story. It wants you to click on it. So clickbait, if you didn't know what it is a tactic that is primarily used to drive page views on a particular website, whether for their own purposes or to increase online advertising revenue. It can also be used for phishing attacks or for the purpose of spreading malicious files or stealing user information. And so you'll see all this type of stuff. I'm sure you've said something like, share this before they delete it again, right? There's this sense of urgency that you've got to share this story or share this post before Facebook takes it down or before your account is, you're put in Facebook jail or whatever that is. So this post is definitely click-based. There's definitely some type of vested interest here. So this is bias all the way. Okay, great. We've got one more for our last example. Should be fairly easy, but can you please mute? Thank you. This post was actually shared on Twitter, in which someone is stating you can vaccinate your kids and then hold a raw potato to the wound where the needle enters, and it will suck the toxins from the vaccine out, leaving only the non-toxic parts. It's a great way to stay healthy and thwart big media. I love that word, thwart. It's not an everyday word. And thwart big media. What is wrong with this post? What stands out to you besides the very cute response that someone said at the bottom about the potato placebo? But what stands out to you about this post? Miranda said, is that an x-ray of a pelvis as the profile picture of a pelvis? That is it is. I didn't even notice that. That is a pelvis in the profile picture. Very observant. But what stands out to you about this post? There is no evidence, Lauren, absolutely correct. Someone's thoughts, no evidence to back this up at all. So lots of no authority and lots of bias. So, but we see these things, right? We see these types of things all the time. Don says, how would the potato know the toxic? I mean, it's ridiculous. It's pretty ridiculous. However, sometimes our clients, let's say if you have a client that really isn't into Western medicine, they prefer home remedies as opposed to going to the doctor and getting prescription medications. And maybe some home remedies have worked for them before. They consider themselves to be a natural path or holistic type of person. So they already have a confirmation bias that lends to this type of treatment. So for most of us that are looking at this is absolutely ridiculous to us, right? But that's not the case for some of our patients that may look at this and say, you know what, I already don't trust the government. I already don't trust big pharma. And you know, I know someone that was cured by eating a whole bunch of garlic, you know, even though the person didn't tell them they were taking chemo and radiation too. So, you know, those are the types of things that you have to combat. So there's definitely authority issue here for sure. So when it comes to evaluating information sources, you should be skeptical of information if, one, you can't verify the claims like that last post. Two, it appeals or plays on the emotions. If it tugs at the heartstrings, not to say it's always not true, but you should be cautious if you see posts like that. If you have a post where the author is not the expert in the field, like our Dr. Young there, you know, if you can't find anything up on him, if he's not peer reviewed and, you know, wrote all of these peer-reviewed journal articles and conducted years of research or backed by a major hospital or teaching institution, you know, it's probably a good chance that Dr. Young has been paid to support that health claim or paid to support that medication. I mean, think about Dr. Oz. Dr. Oz, yes, he supports a lot of health claims and medications, but he also gets paid to do those things as well. Some of them may be factual, some of them not. So you just take it with a grain of salt and continue to do your research. If you can't find that information anywhere else, remember back to that lateral reading, then you want to be skeptical of that information. And certainly if it comes from a fake website like naturalnews.com, maybe it's satire, you know, maybe it's not intended to be real news. You want to be skeptical of that type of information. Now, debunking myths and fact checking does take time, but there are individuals and organizations that actually get paid to do this kind of work. And so you'll all get a copy of the PowerPoint to be able to go and review these websites later. But these websites listed here can be a resource for investigating and evaluating health information sources. Looks like I've got a hand raised. Miranda, I want to go ahead and give you an opportunity to come off mute. Go ahead.
Yeah, I was gonna say, what about like debunking things as far as like, I can think of like influencers and stuff on like Instagram and things where maybe it's like a new idea or like a new concept, or even things like, I'm thinking of like, I have a friend that has PCOS and she does a lot of like personal research and utilizing people who also have PCOS and use like Instagram and influencers and stuff and like maybe what's worked for them. Because there's just like some things that there's just not a lot of science study on. And PCOS is one of them. It's just something that's like hard to diagnose and it's a women's health concern and like some of those things. And so just some questions or like things to think about when we're, viewing maybe not like clickbait articles or articles that are easy to be like comparing, but more of like the influencer like side of things where people are truly sharing like their real life, like lived experience.
That's a great question, and thank you for that. So I have a sister actually that has a very rare sarcoma. It's a type of cancer. She's at the 6-year mark now. And so I just went to MD Anderson major cancer hospital with her last week. And we're now at the clinical research stage, right? So we've done exactly what you've talking about. You look online and see what are, everyday people trying, that they're seeing some type of success when it comes to shrinking the tumor that maybe has not been researched yet, or that the doctors are not recommending yet. So again, I say take those things with a grain of salt. But anytime one of your patients says, I heard about this treatment, I'm following this person on Instagram and they said this works for them, that information needs to be shared with the healthcare provider. Now, is the healthcare provider always going to be receptive to it? Absolutely not. Sometimes they're going to say, oh, that's just, don't Google. I've had doctors tell me that before, because I always say I have a PhD in Google University. And they'll say, oh, don't Google. You'll drive yourself crazy. Don't do that. The human side of us, we want to find out the information, right? And then you have to do pros and cons. If it's something like drinking what does my grandmother do for her diabetes? She drinks a cap full of vinegar every day. How harmful is that cap full of vinegar every day really going to, it's not going to cure her diabetes like she thinks it is, but is it really that harmful for her? So we have to be able to first direct them to their healthcare professional. And then if they're still very set on, I want to try this, I've talked to other people, this has worked before, then we have to weigh the risk versus the pros versus the cons, the benefits versus the risk, and provide as much information for them to make the most informed decision that they can. Great question. Since I'm pausing here for questions before we go into the third point, are there any other questions about anything that we've talked about so far? Great.
What about the .com being not a credible website, but yet Snopes.com and the politicalfact.com?
I'm sorry, say that again.
What about the .com websites? Because two of those fact check sites are .com. So
they are. Yeah, so every single reliable website is not necessarily a .edu and a .gov. When you have a .com, like my website, umembahealth.com, umembahealthacademy.com, it's because I'm a private entity. I'm not a federal organization. I'm not a nonprofit. I'm private. So a .com doesn't necessarily mean that it's not. Again, remember, you have to make sure that source is somewhere else. And so a lot of times, Politico, Snopes, they have information that is linked from those more credible sources. But again, they're private organizations, privately funded or funded by either investors or donors or something like that. So every .com is not necessarily not a credible website. Great question. Great question. Right. So now we're going to transition to the last part of our discussion today. And where am I on time? I need to know. Am I good on? I'm good on time.
I was going to say we're done at 10:30 today, so feel free to go through the slides up until that point. So
okay, great, because we're going to do a scavenger hunt activity, so I'll need about 10 minutes for that. So we're going to talk about now how you can support your clients in finding reliable health information. And again, I love my quotes, especially this one from Julia Kohler. She is a learning solutions lead developer with the Pew Research Center. And she said, information is only as reliable as the people who are receiving it. If readers do not change or improve their ability to seek out and identify reliable health information sources, the information environment will not improve. And this is your task as a community health worker, to help your clients and your patients seek out and identify reliable health information sources. So we're going to practice doing this before we end our session today. I'm sorry, Shantae, you're having issues with your audio. Everybody else can hear me hear me good, correct? Let me see, shaking hands. Okay, perfect. So there are several ways that you can assist your clients in finding reliable health information online. One of them is to do exactly what we're doing today. You can, host and conduct interactive workshops that feature a combination of lecture and hands-on activities where discussion and questions are encouraged. You can assist them by providing culturally appropriate health education resources that they will understand in their language. You can use curriculums to teach them about health literacy and how to evaluate the credibility and reliability of online health information. There's a variety of different methods. I have provided you a handout that will probably be emailed after the session. So you'll get a copy of the presentation, but you'll also get a list of resources that includes these resources here on the screen for you that are available already to help your patients develop health literacy. So there's the digital health literacy curriculum, Learn Internet Skills, which is free online learning modules. I would recommend, if you're interested in learning more about this particular topic, that you take those free learning modules. Health literacy tools are provided by the University of Kansas at Medical Center. Health Literacy Kentucky has some resources on their website as well. And with Health Literacy Media and Wisconsin Health Literacy. So speaking of Wisconsin Health Literacy, we're actually going to use this checklist for our next activity. So you can see here, this checklist is comprised of 2 pages. There is one that has tips for doing an online search. And then there's a checklist that you can use or give to your clients to advise them on how to identify credible health information. I'm actually going to put this checklist on the screen as we do our activity. So our activity is a scavenger hunt. Now that you know how to spot fake and misleading health information, I want you to practice finding reliable health information online, again, using the Wisconsin Health Literacy Checklist. So for everybody that's on today, looks like we've got 72 people on right now. If your last name begins with A through G, you're going to research a very common issue that your clients may also experience. This is heartburn. That's the topic or the term that you're going to research. And you want to find reliable health information about heartburn. If your last name begins with H through P, you're going to research the word migraines. And if your last name begins with Q through Z, you're going to research seasonal allergies. So let me do a new share here. If I can. Actually, I'm going to stop my share and move this screen here. Go. Got it pulled up over here where you can see it a little bit bigger and better. Using the term, I want you to ask these questions. Who's in charge of the website? Why are they providing the site? Can you contact them? Ask questions related to funding, because that matters, the quality and the privacy of the website as well. So we're going to take about 10 minutes to do this. And then we're going to come back and I'm going to ask you some questions about this. So I've got 10:06. Let's take exactly 10 minutes to do this. If you want to turn off your camera for this, you're more than welcome to do so. Are there any questions before we begin? Any questions at all on this activity? Awesome. Okay. Let's go ahead and get started. I'll see you at 10:16. more minutes before we conclude the activity. Okay, so I'm going to leave that on the screen while we talk through this next part, but I'd love for you to use the chat or either come off of mute and tell me if you were able to complete the entire form during that time. Were you able to complete the entire checklist during that 10-minute time frame? I see a head shake. I see Jennifer says no. I see. Okay, Shelly says yes. Okay, so some yeses, some nos. And I'm seeing the last names too. So it depends on, I think, also the topic that you got. Tell me about that. Tell me what was difficult for you to find. What information was difficult for you to find? Yes, that's true, Essence. In addition to basic Google search, you could also go to Google Scholar. Absolutely. Google Scholar is a great place to find vetted, peer-reviewed articles on particular topics. Rebecca said last updated was difficult to find. Somebody tell me some websites, some of the credible websites when you were researching your topic that you found. Go ahead and use the chat box to put those in. So we were talking about migraines, seasonal allergies. What was the other one? I forgot that quick, and I did it. Where's my
Heartburn.
Heartburn, thank you, Joangela, thank you, heartburn. All right, so we got National Library of Medicine, WebMD, Medline Plus, my Cleveland Clinic is a good one. Library, what library, Shelley? Mayo Clinic, great. Those are good ones, all good ones. Mayo, excellent. So those are
National Library of Medicine. Sorry, I'd misspelled it earlier.
Okay, thank you. So all of those are great sources for reliable health information. Do you think it's realistic, and just be honest, if you were to give this checklist to a patient and say, you know, I know the doctor just diagnosed you with, let's say, PCOS, because Miranda offered that earlier. And there's a lot of information that's out there about PCOS. And I just want to make sure that you vet those sources, that you're reading, you know, the most up-to-date, most credible information. So I'm going to give you this checklist. So whenever you find some information, you know, about a new treatment or a new claim, I want you to use this checklist and then vet that information based on these items on the checklist. Do you think that's realistic? Do you see your clients doing that? Shelley said no.
Yes.
You do? Oh, okay. Somebody said yes. Who said yes?
Sherry Tahid.
Sherry. Okay. Tell me, Sherry, about your clientele. that you work with, and why you think they would be invested in this process?
I think people are more invested in their care and wellness than we give them credit for, and just leaving it into the hands of their providers can end up with a one-stop shop situation that does not meet, how people perceive care for them or realistic. So I think we don't give our patients enough opportunities to understand their diagnosis and how they themselves can impact their wellness health. And we shouldn't take that for granted.
I love that. And another thing that I love, I see some, Rebecca's clapping. Oh yeah, I love that. I love that. One of the things that I like about this checklist and some of the other tools as well, yes, it's not one size fits all. There's some clients that are like, I don't want to do this work. But for many of our clients, like Sherry mentioned, they are empowered, more empowered than in past years. And they want to be an active participant in their health. And I think that, I'm a certified diabetes care and education specialist. And one thing I always hated when doctors would say, oh, I didn't refer them to diabetes, or I didn't refer them to diabetes education or whatever type of program, because they wouldn't have gone anyway. We can't assume that our patients won't necessarily do it. Now, if we work, we know our clientele, they live, kind of basically day to day, and they've got a lot of trauma and a lot of things they're dealing with. They might not necessarily do this. Maybe just teaching them about the ABCs, authority, authority, bias, and current. Up-to-date information is going to be a little bit more easier. But for those patients, and we have some that are really invested, that really do research, they bring all their questions in their paper and all of those things to the doctor when they come for their appointments, then we can certainly utilize a checklist like this. So let me see if I can get my presentation pulled up so we can finish up here. We've got about 10 minutes. Let me move this chat box out of the way. Okay, can you see my screen there? What happened? Let me get to the right slide, sorry. You can see my screen, Miranda? I see your face, can you?
Yeah, we can see it.
Okay, you see
I
me.
think you're getting close.
Perfect.
There you go.
Almost there. Awesome. So thank you for doing that. I wanted you also to see, if you were a patient doing this, how difficult it might be to find all of the information, how much time it may actually take. Half of you said you finished, half of you said that you didn't. So it's really good for us always to put ourselves in the shoes of our clients so that we understand and empathize for their experiences as well. So at the beginning of the session, I talked about the growing problem of misinformation and disinformation, and how the internet and social media platforms have enabled misinformation to spread rapidly and effectively. And we also talked about how content that's disseminated through websites and online community is unregulated. So basically, people can say what they want, do what they want. It's wild, wild west. That leaves it up to us as consumers to determine the quality of that information and the reliability of that information. So there are a few steps that you should remember as you're working with your clients. Understand their health information seeking behaviors. And we just talked about this, which is why I asked that question. Depending on your clients and your patients and that where you live and their SES status, their health seeking behavior is going to be quite different than somebody that lives in the valley and is really big into wellness and maybe shops at Whole Foods and goes to all of these different kind of, participates in these health activities. So you have to understand how they seek information so that you can help them that way that best fits them. You need to understand how your clients engage with health information online. In 2013, according to one study, 72% of US adults looked online for health information. So if that was in 2013, you can imagine the numbers are higher now, but that doesn't mean everybody does. So keep in mind, there's some individuals that are less likely to get health information from the internet. Older adults, not in all cases, but sometimes older adults, those with lower health literacy. I know I have a couple of uncles that are classified illiterate. They're not going to be Googling anything. So keep in mind that some people don't engage with health information online like that. Understand how misinformation spreads, and we talked about that a lot today. You know, some people have vested interest. Maybe they're trying to make money, they're getting paid under the table for promoting certain things. Some people just want to cause misinformation and chaos and confusion, and so they just put things and stories and articles out there to do just that. There's, of course, media, gossip, works of fiction, and satire. So understand how information spreads and make sure to vet those sources using the ABC method. And then lastly, be aware, and we've talked about this once before, your biases, and be mindful of confirmation bias. So confirmation bias is a type of cognitive bias that involves favoring information that already confirms your previous existing beliefs or your previous bias. So, you know, if I believe that people shouldn't have abortions, then I'm going to consume content that says people shouldn't have abortions, you know, pro-life. If I believe, if I'm an anti-vaxxer, I'm going to, chances are, consume content and share content that lends to how I view the COVID-19 vaccination or vaccinations in general. Confirmation bias, it really does impact how we gather information, how we interpret information, how we recall information. And characteristics of it include not seeking out objective facts, interpreting information to support your existing beliefs, only remembering details that uphold your belief. We're really good at this. If it's something I already believe in, I'm going to remember that source. I'm going to remember that. If it's something that's completely discrepant or completely opposite of what I believe, chances are I'm going to forget it, right? And then ignoring any kind of information that challenges your belief. Those are all things that you need to be mindful of as you're working with your clients to help vet credible, factual, accurate online health information. So a recap of the learning objectives, because I know you're going to be doing evaluation soon. I hope that now you understand why misleading health information is indeed a threat to public health. I hope you know how to spot fake misleading health information and prevent its spread. And I hope you have a better idea of how to support your clients in searching from health information from reliable sources. And I'm going to leave you with one more quote before I open up the floor for questions. This is a quote from George Bernard Shaw, who said, "Beware of false knowledge. It is more dangerous than ignorance. Remember, misinformation and disinformation can be dangerous, and it is a threat to public health. However, now hopefully you're equipped with the knowledge that you need to help your clients find and validate reliable health information online." So at this time, I'd like to open up the floor. I think we have just a few minutes if there are any questions that anyone has at this time. And if there's no questions, that means I either did a really bad job or I did a really good job. Okay, go ahead, Miranda.
I was going to give everybody else a second in case I had a question. But one thing that I wanted to, I guess, like touch on or like maybe get your feedback on is I remember during, especially during like the latest like political campaign for presidency, when Facebook actually put the censors on a lot of the content that was on there, that it would put like, it would have still like the article title on the bottom, but in order to like see the picture or to like read the article, it had a thing on there that had it blurred out, and it was like, you know, that this content is misinformation, or misinformation, and like, are you sure you want to view it, or whatever it was. And I don't know whatever happened to that, or maybe they just got a lot of grief. And I know Facebook has had their own issues between then and now. But I think that, I don't know if that's like one way that can, you know, help with combating some of that information, or if that was hurtful. I'm not really sure.
I think it was great. And I actually think Twitter did it first, because Facebook was actually catching a lot of flack because they were allowing a lot of it to be shared without the disclaimer. Twitter did it first and then they followed. I noticed a lot of it was really tied to, I want to say, the political atmosphere at the time. And then once there was a change of administration, it seemed like that went away. And so a lot of the information that is shared is politically motivated, right? And so we have to be aware of that. I liked it a lot because, you know, like I said earlier, it had some sort of regulation, at least when they were doing that. You know, with these open forums, you really can't put a cap on anything that anybody says. It's an open forum. I should be able to say what I want and express my viewpoints. But I did feel that there was some responsibility on behalf of Facebook and Twitter. And I appreciated that they were able to say, hey, we were not able to fact find this. You can read at your own risk. Do I think that it helped with the infodemic? Absolutely not, because of confirmation bias. And so people still, you know, if this is my party and these are my thoughts and this is what I think, they still want that information, regardless if it's true or not. That's the scary part. Regardless if it's true or not, if it pushes my agenda, then by golly, I'm going to share it. And so that's what we really have to combat in today's day and age.
Yeah, that makes sense. I was thinking of too, like, how many of like family members that were like, they would share something and they'd be like, oh my gosh, like Facebook censored this or whatever it was, or like, I can't even share, you know, like my beliefs anymore on social media or whatever it was. So I thought that was like pretty interesting.
Yeah, you know, my husband is actually a new citizen, but he's Nigerian. And so he told me years ago when we were really getting to the infodemic, right, you know, at the onset of COVID, and people were doing, you know, saying all kinds of things and being censored and, you know, getting offended by it. And he said, there's the thing about United States of America, the best thing about it is your freedom. But the worst thing about it is your freedom. And it was so eye-opening when he said that, because we have that freedom of speech, we can make up stories, we can say what we want. But at some point, we've got to think about the greater good. And that's where public health comes in. Yes, you can say what you want. Yes, you have, you know, your agenda or your viewpoint, but when it harms other people, it's not okay. And, you know, we have to have some type of regulation. We don't have it. So again, them attempting to do that during that time, what was a good intention, I think, on their part. A lot of pushback from a lot of people, though, about it, but it was a good intention. So any other questions? I think I'm out of time. It's been great. I hope I can come back again. Thank you all so much for spending your time with me this morning, and I will pass the mic back over to you, Miranda.